Okay, medication, assistance with self-administered medication.
Medication management.
Let me just...
Assistance with self-administration of medication and medication management. Unlicensed persons who will be providing the assistance with self-administration of medication must meet the training requirements prior to assuming this responsibility. Courses provided in fulfillment of this requirement must meet the following criteria.
Before we go any further, unlicensed persons are not people who took a medication training class. They're actually licensed through the state, like a nurse practitioner, a doctor. Those would be considered licensed. Everybody else is unlicensed. Okay, so unlicensed persons. I know people always get confused. Your quiz questions, your state exam questions will say an unlicensed person. Okay, and that doesn't mean a person who took a medication training.
Right. It doesn't give you a license.
No. Okay. A, training must cover state law and rule requirements with respect to the supervision, assistance, administration, and management of medication in assisted living facilities, procedures and techniques for assisting the resident with self-administration of medication, including how to read a prescription label, providing the right medication to the right resident, common medications, the importance of taking medications as prescribed, recognition of side effects and adverse reactions, and procedures to follow when residents appear to be experiencing side effects and adverse reactions, documentation and record keeping, and medication storage and disposal. Training shall include demonstrations of proper techniques, including techniques for infection control, and ensure unlicensed staff have adequately demonstrated that they have acquired the skills necessary to provide such assistance.
Right. And if you don't have any background in assisted living or healthcare, you can always take the 6-hour medication class prior to taking the state exam. And I know that helps a lot of people, and it just really focuses in for 6 hours on the medication.
Yeah, just because you're a nurse, we've had nurses call us and say they failed. And when you don't pass the state exam, it'll tell you what areas you're weak. And sometimes nurses don't, because it's more so about what unlicensed people can and can't do, and is this person doing something appropriate to their license or skill level.
So the training must be provided by a registered nurse or licensed pharmacist who shall issue a training certificate to a trainee who demonstrates in person or both physically and verbally the ability to read and understand a prescription label, provide assistance with self-administration, including assist with oral dosage forms, topical dosage forms, and topical
otic and nasal dosage forms. Measure liquid medications, break scored tablets, and crush tablets in accordance with prescription directions. C, recognize the need to obtain clarification of as-needed prescription orders. I don't want to pass over that because you're going to get quiz questions on that. As needed.
It's also PRN.
Yeah. Is this resident capable of asking for an as-needed PRN medication? If it's not clear.
Let's give it an example.
Okay.
So Calais needs Tylenol for a headache, and the doctor writes, give Calais Tylenol for a headache. Give 1 to 2 tablets. Now, Calay's not able to ask me for that and understand what it's for, so I can't make that determination whether he needs 1 tablet or 2 tablets, his level of pain, because I'm assisting him with it. I'm not administering. I'm not a nurse. Yeah,
there should be no gray area. It should be spelled out specifically as if the caregiver is looking at it and you've got somebody who can't make that determination. And it's probably a good idea for it to be spelled out.
Right. So it's either 1 tablet or 2 tablets. See, it's really easy. You just call the healthcare provider back or call the pharmacy and have them handle it for you, and just have them put 1 or 2 tablets and clarify. Another thing is the Xanaxes and what's the other one that's real popular? The relaxer.
I'm not sure what you're talking about.
Ativan.
Yeah,
yeah. So sometimes a doctor will put Ativan PRN as needed for agitation. Well, I'm the unlicensed person, so I can't make that determination if any of these residents have agitation, so it needs to be scheduled. So it might be 1 tablet every 6 hours for agitation.
Right. Okay. So we got clarification of a prescription order. D, recognize a medication order which requires judgment or discretion. So that we just talked about that. I mean, does it require the discretion or judgment of an unlicensed person? I mean, a nurse can make the determination if somebody is agitated, for example, but a nurse is not always assisting with medication, or a nurse may not be there 24 hours a day. So if you have a medication that says give to a resident if agitated, and there's not a nurse on duty all the time, then you may be in.
And we learned that lesson the hard way because we actually got attacked for that. When she came in and she saw the residents in the waiting, in our, I think she was in the living room, and she said, let me see the medication book for this particular resident. And she saw that her Ativan was as needed for agitation. And she said, well, I see you're signing for this medication. Are you giving it as needed? And I said, yes. And she said, are you licensed? And I said, no. And she said, well, how do you know the resident is agitated that you can give this medication? And I thought to myself, okay, I'm wrong. But I said, well, let's look over at the lady in the living room who's getting ready to punch the caregiver right now. And I said, well, this is how I know she's agitated, because she's getting ready to punch someone. However, that wasn't adequate enough because I'm breaking the law. And so we had to go back to the doctor and explain where we come from, that we're not licensed persons administering medication. So we had to get it scheduled to where it was, 1 tablet every 6 hours or whatever the doctor changed. So that's,
or change the medication if need be.
Right.
And I think in that situation we might have.
Right. Well, we all know that, when a person's agitated, probably, especially these residents, because they're near and dear to us and we take care of them. But, the rule is only licensed personnel can make those judgments.
Yeah. Okay. So recognize a medication order that requires judgment or discretion, and to advise the resident's healthcare provider or facility employer of inability to assist in the administration of such orders. So your staff should be trained in that situation to recognize if a label or something is written improperly, because really we're all part of the same team. And there's lots of medications and things just come in and get prescribed and come in from the pharmacy with the wrong label on it, and it gets on your med book or on your MARS. Then everybody needs to understand where we've gone into the territory of a citation.
But I can tell you, if you work with a really good assisted living pharmacy that has experience in this, they'll catch these things, or they could. I mean, ours did. They'll catch them before they even send them out to your facility, and they'll either check with you to make sure that that's something we want changed, or they'll get it changed for us right away because they know the resident too. So that's the benefit of using an assisted living pharmacy, and even something that you have a really good relationship with them.
Right. The training must cover how to complete a medication observation record. We call them observation records because technically the unlicensed, when you're assisting with self-administered medication, the residents are assisting and then observing, rather than a lot of people are familiar with MARS, medication administration record. We don't, and you can do administration, but we're talking about assistance of self-administration. So they complete the medication observation record in the training.
And it's called an MOR. For short.
They need to be able to to retrieve and store medications. So they need to know how to retrieve it and how it's stored properly. Couldn't be just left out on a resident's table, even in a private room, if other residents could see it or access it. G, recognize the general signs of adverse reactions to medications and report such reactions. H, go ahead, Cheryl. Oh, yeah. Yeah.
So assist residents with insulin syringes that are pre-filled with the proper dosage by a pharmacist, and insulin pens that are pre-filled by the manufacturer by taking the medication in its previously dispensed, properly labeled container from where it is stored and bringing it to the resident for self-injection. You can also assist with nebulizers.
Yeah, assist with nebulizers. Use a glucometer to perform blood glucose testing. So after they have this 6-hour training, the unlicensed person can do these things. K, assist residents with oxygen nasal cannulas and continuous positive airway pressure, CPAP devices, excluding the titration of the oxygen levels. So they need to be set. You can't make adjustments on it. Like if their O2 levels get too low, change it to, no, it needs to be preset. And I think too, they may want to see that the resident knows how to make those adjustments. Apply and remove anti-embolism stockings and hosiery, so they can assist with that. And placement and removal of colostomy bags, excluding the removal of the flange or manipulation of the stomacyte. And N, measuring of blood pressure, heart rate, temperature, and respiratory rate.
Unlicensed persons who provide assistance with self-administration medications and have successfully completed the initial 6-hour training must obtain annually a minimum of 2 hours of continuing education training on providing assistance with self-administration medications and safe medication practices in the assisted living facility. The 2 hours of continuing education training may be provided online. So the 6 hours is in person. The 2 hours can you do it online? You can do it online, and you can take it at my ALF Training.
Yeah.
And remember, it's annually. So the word annually is, they use that in the test instead of every year. They may say annually. You need the 2 hours of continuing education and the 6-hour initial training. I'm pretty sure there'll be some sort of
a test question.
Right.
It is a test question, 6 hours, and then the annual. Now, your staff, if they let that 1 year annual, let's say January 1st is when you got your 6-hour training, 2019. If you don't get the 2 hours before January 1st, 2020, they need to retake the 6-hour training. And you got to have a continuous track of it. So for 10 years, if that employee's with you for 10 years, they're going to want to see it. Basically, it's going to, your 2-hour annual will be at least 1 day earlier every year because, January 1st, next year it's got to be before January 1st, maybe it's December 30th, and then it just continues. So it's within a year. Okay, next is trained unlicensed staff who, prior to the effective date of this rule, assist with the self-administered medication, have successfully completed the 4-hour assistance with self-administered medication. Training must complete an additional 2 hours of training that focuses on the topics listed above. If they haven't,
so
you're gonna go ahead.
So you'll have employees that have come with the 4-hour training before the rule changed to 6. We have 4-hour training. All they need to do is to have that additional 2 hours and keep the certificates together along with all their continuing education.
You may as well just send them. I mean, if the trainer may let you send your staff for, if it's a 6-hour training, they may let them come for the back end of the day, depending how they structure their training. But I think a lot of trainers probably have phased that out, and maybe it's only the 6-hour, and maybe they do a continuing education as part of that as well. So you have to check with the trainer if they even allow that bridge training. Otherwise, just send them to get the 6-hour training. But could be a quiz question. I don't know about that.
People should be getting caught up too, so hopefully you want to encounter that. Nutrition and food service. The administrator or person designated by the administrator as responsible for the facility's food service and the day-to-day supervision of food service staff must obtain annually a minimum of 2 hours continuing education in topics pertinent to nutrition and food service in an assisted living facility. This requirement does not apply to administrators and designees who are exempt from training. A certified food manager, licensed dietitian, registered dietary technician, or health department sanitation is qualified to train assisted living facility staff in nutrition and food services.
Okay.